No, I absolutely don't. And I think, in fact, it killed people. So, there were plenty of people who, when they were being repeatedly told to stay home and protect the NHS, did just that. And so when they actually needed healthcare, they didn't turn up. And you can see it in the data. The number of people coming to the hospitals for emergency conditions was through the floor. It fell to about half of normal levels. And there was a study from Milan which showed that people who had life-threatening surgical emergencies, like appendicitis, something that's going to kill you if you don't get the operation, the numbers of people turning up for those halved. I mean, it's really, what's really insane. People genuinely didn't, the people you would have thought had no choice but to go and seek medical care didn't seek medical care. And a group of pathologists in Oxford reported on postmortems they did during that first lockdown. And it included, somebody who was dying because they were having a heart attack and they phoned 999 and they were told they should self-isolate because they had a cough or a fever, and that happened to someone with diabetic ketoacidosis, and then they died. So, we were not providing healthcare the way that we should, so people died from that. And I guess the second part of your question about freedoms and what does it mean when what are the sort of, is there a benefit, right? Is there a benefit of taking away people's freedom? And the answer really has to be no, because there's, people will have argued the same arguments again and again. So one argument people will say is, what if it was Ebola? Right, that's a favourite. And Ebola is a scary disease. It has a high mortality rate. Yeah. But it's spread through close contact with bodily fluids of somebody who's infected. So you quarantine the sick. You don't need to lock down the healthy. So that's Ebola. And then you've got situations like we had, where you've got airborne transmission of a virus. Now, it doesn't actually matter how deadly that virus is if you can't do anything about its spread, right? The logic is not around, but it's scary. If interventions aren't working, you don't do them regardless because it's pointless. So that's airborne transmission. So then you're left with a sort of middle ground of illnesses that are spread through close contact but aren't going to make you as sick as Ebola. So that they're essentially the kind of gastroenteritis category. So diseases spread through the fecal-oral route. And what we saw in the data when we did lockdown, so we've done the experiment for this, the people who showed up to hospital with gastroenteritis, the levels halved. So people were still catching it, it was still going on, it halved. And given that the levels of general attendance halved too, maybe nothing changed. But let's assume it did actually halve. All you would be doing then by locking down is slowing the spread. Now remember what I said about July 2020 being the modelling for peak in close contact transmission. So you're going from something that would have peaked after 3 months and then fallen 3 months later. So it would have been a 6-month trajectory. If you're slowing the spread of that, then you're likely destroying society for a year. And so then you're having to weigh up, you're not saying that you're stopping this disease. You can't stop a disease. You're slowing the spread from 6 months to a year. Is that really worth doing? And the answer is probably not, because it's so slow anyway. So those are the scenarios, and there isn't a scenario there where lockdown is going to be the answer. And that's why it wasn't in any of the pandemic plans anywhere in the world, because it wouldn't work. It's not worth having. It's not, and it's clearly going to be harmful. It was quite clear from the outset it was going to cause harm, and we now know that it did.